Welcome to the River Park Dental Show. I'm Dr. Phing Saurer, and I'm here today with Michael Morris.
Phing, it's good to see you again.
It's good to see you.
And as always, we're on Facebook Live, so if you're watching this now, hello. If you're watching or listening on Sunday, you can watch this later on YouTube, right?
Yes.
You guys were using the YouTube last week, weren't you? I think Ellen was trying to make... Don't say the YouTube. That's like when people say the Facebook.
I joined the Facebook last year.
Nope, it's just Facebook.
And the Instagram.
No.
So it is the YouTube.
You have to take the part out. That makes you sound like when my grandfather would say, I joined the YouTubes.
I am essentially like a grandfather joining the YouTube.
Okay, you're still saying it.
Well.
Anyway, the point of it was you can watch any of these shows on the Morris Media Productions channel on YouTube, so you can see Dr. Phing. If you've never seen her in all her 5-foot glory, you could actually see what she looks like if you don't go to River Park Dental, right?
Yeah, or you can go to our website, look at some pictures.
That's where you're supposed to say you should come into River Park Dental.
Come in. Yes, do everything. Come in, check us out.
Get a Sonicare brush.
Get some, and gift cards to, I don't actually remember, the Ram, local cantina.
The guy who we're going to talk to in a couple hours listed like there's 9 restaurants right outside River Park Dental, and I think 7 of them are not open. Yeah, well, they're going to be open this spring, summer, so it's coming. It's coming. The calories are coming. So they can get their teeth cleaned first and then go eat.
Yeah, or eat and then come get your teeth cleaned.
Does that bother you, by the way? Like when someone eats or drinks or something?
I'm not the one doing it. So
that's true. So the hygienists probably don't care. No,
well...
Or you don't care about hygienists. Which part is it?
I don't think they care. They don't.
I'm pretty sure they care.
Go eat and then get your teeth cleaned.
Okay.
Or vice versa. We don't care.
I like that you make decisions and you stick to them. Either way, whatevs. I think we should get into our topic since last week we started with Pretty in Pink and I hadn't seen it. This week, I thought this was important because this was just a day ago. Sugary drinks lead to obesity, dental problems, and possibly early death. Which one would you like to address first?
Oh, my.
I think we could peel off the early death thing.
Yeah.
To be honest. Yeah, so, but I thought this was a really important article because when we're researching things for the show, I wanted to get your take on the amount of sugary drinks that people, I know that you're dealing with all age groups, but are you seeing a lot of that? Because I get warned every single Sunday at my family dinner that we have to stop drinking Mountain Dew. From people that are not dentists, by the way. Yeah,
Mountain Dew is one of the most...
It is an amazing drink. Well, it's not good, is what you're saying.
It's not good for your teeth, but it's
good.
Good to keep you awake.
Okay, so we're not hating on Mountain Dew. You're just not supposed to have that if you want teeth.
Well, no. So I am not opposed to sugar. It's just how you're drinking the sugar. So if you're just like pounding that Mountain Dew in 2 minutes, that's not a problem. But if you're drinking that one can throughout the entire day, you're just kind of like making a sugar bath for the bacteria in your mouth and just causing the cavities, feeding the cavities, the bacteria that makes the cavities.
Is that the same thing with Gatorade?
Yes.
Because it's the amount of sugars. Explain how that breaks.
When they have their mouth guards and they're drinking that Gatorade, and that Gatorade's just swimming in that mouth guard, and then they're just feeding that bacteria.
We should have probably started and said if you're eating while you're watching or listening to this, probably not a good idea. I forgot we were going to talk about bacteria.
Is this disgusting? I don't think so.
No, not to the average person just driving around. No, it's fine. But what is it that leads to that? So you have bacteria already in your mouth, right? So this is just like compounding it.
Yeah. Well, I mean, you have a lot of bacteria, but then there are bacteria that causes the cavities. And so if you're drinking a lot of sugar, and that's just kind of basically continually feeding them. So if you want to drink the sugar, that's fine, but just drink it quickly and then, rinse out your mouth with some water, neutralize everything, and then it's fine, and then brush regularly.
Can you tell when somebody is like just addicted to just hammering sugar all day?
Yeah.
Like when they come, so you can tell?
Yeah.
And you judge them, don't you?
No.
Oh, no,
I don't judge them, but, you can tell. So
do you say things? Do you say like, you might want to cut back on your sugar intake or do you drink a lot of soda?
I think a lot of people know, though. It's not like they try to lie about it. So they are aware. It's like, that smoking's bad, but people will still do it.
I've not heard that. I mean, I don't read a lot of research about it, but smoking might not be that bad.
You've never heard that?
Well, I do think that I've heard so many things about the amounts of sugar because have you ever seen the documentary that Katie Couric did that I just forgot the name of? Let's just say you have.
I haven't seen. I don't watch.
I'm
TV.
sorry.
You know,
I know you're
we're talking
busy.
about movies.
You're
and
touching
TV
molars all day.
and-
I understand. But what in this documentary, which I'll probably remember as soon as the show's over, they were talking about the amount of sugar in our foods and how I think it's by 2035, 50% of children will have diabetes because of the amount of sugar in the foods that we're eating.
That's probably true.
So you see this, and as a clinician, you have to look at this because, as we've said before, you're a doctor.
And
Right.
that's true.
So you see this. Do you feel that you need to kind of step in and tell parents about this, or kids like you might want to cut this back because this is
No,
totally
we
unhealthy?
definitely advise, and I think parents are aware, but I think they need to try to find that balance too between, because I don't think you should just completely take things out of your life. You need to enjoy things. You just have to do it in moderation. And I think that's what they need to teach their kids. Because I think sometimes if you cut back and you don't let them have it, they want it more.
Right.
So, let the treats happen, but just make sure that they're eating it moderately. And then also the preventative care, like the brushing and the flossing and doing all that stuff too.
Is this why you give away that sugar-free candy that's terrible at your office?
Yes. Yeah.
That was a nice treat to give us the first time we met.
Oh, did you like it?
It was not. I immediately went out and ate some real candy.
No, it was good.
Rachel liked it, but Rachel's like, she's eating like
but
1
she's
mint a
also
day.
has like 10.
Jim likes it. Jim's off mic and Jim likes it, so it's fine.
Oh, did you bring one for Jim? How
I
many
did not.
did you take from
Listen,
my office?
It's not that I take the candy from your
my
office.
Goodness.
We were trying to use that coffee
We were
machine that looked like
running
the
low.
Titanic in the
Now I
front of the
know why.
office. Well, we didn't know what we were doing. So when you're looking at these patients that are coming in, like you're just going to tell them like maybe cut back. You're not going to tell them to restrict it totally.
No, not. You don't have to completely restrict anything, but yes, cut back for sure.
I just think it's weird that you can actually see it. Like you actually can tell when someone gets in that chair.
Yeah, I mean, because they have a lot of cavities, right? And then it's like, and you can tell when people aren't flossing because they have a lot of the cavities in between their teeth where you're supposed to floss and wash, bring things out. So you can kind of like,
They have cavities in between their teeth?
yeah.
How is that?
What do you mean? How is that?
Well, I mean, you're a dentist, so how do you get cavities in between your teeth is what I'm asking. I didn't even know that was a thing. I'm not a
I'd
dentist,
have to show
Phing.
you an X-ray then. I
Please
can't
don't.
explain
I can't
it.
look at those x-rays.
Have
They're
you eaten-
gross.
Have you eaten yet?
No.
Well,
And I will
I'll
not go
show
back to the
you.
office with you. I'm just trying to point out. I didn't even know that. I don't know how many people actually know you can get.
Yeah, because food gets in between your teeth, and that's why we promote flossing because that helps clean in between your teeth. And then after that, but if you're not, the food gets stuck there, it feeds the bacteria, causes the cavities. But fluoride will help, flossing will help.
So when you're looking at patients that you get in, do you see, I'm not saying like name people, but with the obesity rate that's, if you're looking at, is going up year after year.
Yeah.
So you're seeing that and you know where that's attributed to. It's not just a lack of exercise, it's what they're eating. Do you see that people's eating habits are kind of, I mean, are you, because you are a doctor, do you see that there's some things you need to kind of, like you're concerned about and you relay to the parents or the person that's in that chair? Because I would think it would be one of those things like you are a clinician. So I would think you would say.
No, we definitely pay attention to the whole thing. So, if they're overweight or they have high blood pressure or they have diabetes or anything, we're paying attention to that. And then we do make recommendations if their blood sugar is high or their blood pressure is high or, I don't really, it's just living a healthy lifestyle. So we're not saying, oh, you're obese. I'm not making those kind of diagnoses.
I would hope not. What? That's no bedside manner. Listen,
No.
You're a biggin. Like who would lead with that?
Biggin?
Yeah.
What?
You're a big one, like a biggin. Yeah. Don't use that later. That's not something you would say.
No, I would not use that. I didn't know that was a technical term. I've never heard of it.
It is a technical term. I'd like to use it a lot of times as it comes along. So as you're going down this path, you've got somebody that you can tell is not living a healthy lifestyle.
Yeah.
You're not going to badger them, but you are going to kind of point out some things.
Yeah.
How would you know? Do you get their medical history as well? Because you said if they have high
Yes.
blood pressure and diabetes. So
We take their blood pressure. We take
Do you
their.
really?
Yeah.
I've never had that. And all the times I've gone to the dentist, I've never had that.
Really?
No.
Well, I mean, we take it. We want to make sure that it's not overly high because if we ever have to use anesthetic, we want to be careful. So we do that. We take an extensive health history. I don't know what else. Yeah, you take the whole overall thing. So you just want to make sure they're healthy.
Where did you? That's got to be a new thing because honestly, I've never had that done.
I did it all through dental school.
Oh, I don't know that you need to brag about it. I'm just saying. No, I had no idea because I was wondering what would happen if somebody had an emergency in that chair, like a health emergency. Like you have to be prepared for that, right?
Yes.
Or the hygienist just runs out of the room and makes a phone call.
Well, no, we're all prepared. So we all have our basic life support training. But then I also have my ACLS and then my IV sedation training. So I can do a little bit more than that. But of course you call 911 too. I'm not delivering babies or doing anything crazy or, doing.
Could you deliver a baby? Now you just
I could probably. Yeah, sure. Why not? Let's just boil some water, right? That's all you need.
I think that's all they did in the 1800s. But if
I have a scalpel, like it's good.
Would you give them a gift card?
Yeah, maybe
to
two.
The RAM?
I'd probably give them two.
Yeah.
Because then, if they leave with two people.
I'm just going to say this. If you deliver a baby, we should probably do a show on that.
If that ever happens, which will be never.
Yeah. Put that on Instagram, though. It'd be awesome.
Yeah.
Can you imagine? They'd be so
people
grateful.
Would love the pictures.
They would call that baby Little Ping. Boy or girl, it wouldn't matter.
It is a unisex name.
Yeah. It's spelled Phing, which when I first read it, I'm like,
Phing.
Yeah, I just didn't say your name.
Oh. What did you call me then?
I was like, hey, Doc. How are you?
Oh, okay.
And you just sat there, menacing, looking out the window, just not smiling at all. That was a good look for a dental person. I'm not going to smile.
Was I like just in the?
Yeah, it was like so dismissive, and yet here we are doing this. My nightmare continues. So I want to get back on track because you're getting me off track.
Sorry.
So obesity leads to dental problems. How do you see that? And we're going to have to take a break here shortly, but could you give me kind of like what you see the obesity kind of leads to? I mean, obviously cavities.
Yeah. I mean, I guess I'm not sure what you're trying to ask me. Like,
well, first of all, what I'm saying
can you rephrase that, but in a way I can understand?
Can you use it in a sentence? What I'm saying is if you have dental issues, if you have obesity, chances are you're eating more sugar, right?
Yeah.
Which is leading to more cavities, which is leading to more gum disease, periodontal disease, things like that.
Okay.
Yeah. I studied.
Yeah.
I did some research.
You just said periodontal disease. That's pretty good.
Well, you also said you could deliver a baby. So I just want to point out I am
in
also
theory.
prepared.
I'm not saying I can.
I'm not saying you should. But what I'm getting to is I want to know, what do you see in people's bodies? Because everything kind of starts with and ends with your mouth, right? I mean, whatever you're putting in your mouth is affecting your whole system. So it is affecting if you have gum disease, your mouth is bleeding, whatever it might be. Eventually, it's going to lead to how you're eating.
Right. So I think that there's a lot of factors into it. So yes, the bacteria in your mouth, they have found that it can be found in the people with heart disease. So it's been found in stuff like that. But I would be careful to say it causes it. So I think it's
but it could be a contributing factor.
It is a contributing factor. But then that also leads to people, then they might not be exercising, and they might not be eating properly, and that all contributes to it. So I think it's that overall general health, and starting with the mouth would probably help immensely. But then it's also, they have to do the other things like eating healthier, exercising, doing all those things as well. So it's just a combination of everything.
It's amazing we actually got to that point right before the break. Like I was hanging on for dear life. Well, you
rephrased the question.
I'm a good rephraser.
So I understood.
I'm a good rephraser. Let's take a break right here, and we'll be right back. You're listening to the River Park Dental Show.
Do you dread going to the dentist because you hate getting shots? I'm Dr. Phing Saurer, and I'm excited to share a needle-free solution with you at River Park Dental. I use the Celea laser, the latest advancement in the dental field, to perform many procedures. No needles, no drill, and no more fear. Come see me and my team at River Park Dental. To learn more, visit us at riverparkdental.com. River Park Dental, where we practice tomorrow's dentistry today.
Are you an outdoor person? Do you want to do creative work? Check out the job opportunities at Greenscapes Landscape Company. We are now hiring for our new Northwest location near Dublin. No experience necessary, just a great attitude. We offer great pay, health insurance, and a company matching 401k plan. Go to greenscapes.net for an online application or call Sandy at 614-837-1869. Greenscapes is an equal opportunity employer.
I'm Dr. Phing Saurer, your dentist at Bridge Park. Have you ever been to a dental office and received bad news? Then you were told to see a different dentist with a different set of financial policies at an inconvenient location? At River Park Dental, once you become our patient, we won't ask you to see anyone else. My team and I are highly experienced and are proud to offer all services for you and your entire family under one roof. To learn more, visit us at riverparkdental.com. River Park Dental, where we practice tomorrow's dentistry today.
This is Dr. Dan Reed, DC, at Mission Chiropractic and Wellness. If you are pregnant and strive for optimal health during pregnancy, labor, and post-birth, call us today. Mission Chiropractic specializes in chiropractic pregnancy care, and research shows chiropractic is the safest alternative for expecting mothers to improve discomfort during pregnancy and overall health outcomes for the mother and child. Schedule an appointment at our office. Call us at 614-559-8666 or get us online at getmissionchiropractic.com.
Hi, this is Jeff with Myers Jewelers. If you're in the market for an engagement ring and or wedding band, then let Myers Jewelers be your one-stop destination for this bridal season. At Myers Jewelers, we have teamed with some of the finest designers in the world. From Tacori to Hearts on Fire to Martin Flyer to Simon G, Sylvie, and many, many more. Along with our great selection of designer ring styles, we have a multi-million-dollar selection of certified loose diamonds as well. Come visit the family on Stringtown Road in Grove City and experience Myers Jewelers.
Hi, I'm Dr. Phing Saurer, owner of River Park Dental. My team and I provide tongue and lip tie releases with a CO2 laser for babies struggling to nurse. We understand how stressful this can be. To make it easier for you, we bill our fee to most medical insurances. That way you can focus your time on what's important, you and your baby. We are proud to be your local provider. To learn more, visit us at riverparkdental.com. River Park Dental, where we practice tomorrow's dentistry today.
Hi, this is Marty Reed, and I'm the owner of Frog Hauling. We are Columbus's only green residential mini dumpster service. If you want to clean your garage, you want to clean your basement, or maybe clean your yard, give Frog Hauling a call, 258-3764. At Frog Haul, we also service contractors, and if only the best product will do for your customer, give Frog Hauling a call. Visit us at froghauling.com or call us at 614-258-3764.
Hi, I'm Dr. Phing Saurer, your dentist at Bridge Park in Dublin, Ohio. If you aren't feeling confident and dream of a brighter smile, we can help. For $450, we can make your smile movie star white in just an hour in our office. Or we can make you custom fit trays and gel to take home for $125. If you need a quick solution, we offer pre-filled whitening trays that are just $30. A confident smile is on the way. We've got you covered. To learn more, visit us at riverparkdental.com.
Honey, you've been in a terrible car collision. I don't know what to do. How will I pay the bills? Who will take care of us now?
This changes everything. You must act quickly to find someone to protect you from the medical, legal, and insurance problems to come. You need money. At Scott Elliott Smith Law, we've been successful protecting families for over 35 years. Let us help you get your life back. Call 1-800-311-LAWS or visit us online at sestriallaw.com. Get Scott Smith. Get justice.
Welcome back to the River Park Dental Show. This is Dr. Phing Saurer with Michael Morris.
Ping, if people want to get a hold of you at River Park Dental, how would they do so?
They can come to our website at riverparkdental.com or call us at 614-689-8686.
Getting back to our conversation about sugary drinks leading to obesity, and as this article says, and leading to possible death. Okay.
That's a very serious title.
Well, that's what drew my attention to it, because I thought, cool. It ends really big. There's a big crescendo at the end. So I want to talk about something a little bit more uplifting than that, because we were kind of talking in general about obesity and dental issues. And we were kind of getting on the subject of children. You do volunteer work with an organization already. So you are dealing with children of all ages there too, right?
Yes. So I volunteer pretty regularly at Kids Smiles on Bethel Road. And it basically offers dental care for children. And you have to qualify for it, but it's $10 a visit. So it's affordable for parents to come and bring them in. And then they get hygiene. And then if they have any issues, then they can come and see the dentist for work. And so, yeah, I see a lot of different kids there. And it's
$10 a kid
per child, I think. Yeah.
Let's just say that and let's see if that works.
Yeah. But, just it's kids' smiles. So, if you ever want to donate and money and stuff to that organization, it's great because I do volunteer my time Friday afternoons when I'm not working.
When you see these kids that are coming in, these are obviously people that can't afford dental care or have health care limitations.
But they still care about their kids.
Well, that's what you were saying during the break is they still care about their kids. So what is it you're seeing in those kids? Because if you can't afford dental care, you're probably not eating the healthiest. You're probably not, it's not a salad or celery snack type of family. Are you seeing a lot more kids that are having issues where you can see the development of diabetes? Not that you're diagnosing it, but you can see that there's health issues there.
Potentially, I guess you're right. I'm not diagnosing, but they do. Yeah, there's definitely potential there with diabetics or obesity going on to that. But they do have a lot of decay too, where we do actually have to do extractions. I try to do as many fillings as I can so that we can avoid those kind of procedures, but sometimes it's inevitable.
What age are you doing those extractions? Is it 4 to 6? Is it 6 to 10? I know it's different in every case, but there's got to be some.
They can be really young, So sometimes if the tooth is what we call if it's just completely gone, bombed out.
That's an awesome term, actually. You call it bombed out.
Yeah.
Not to them. You don't go.
No, I'm like, your tooth is bombed out.
Your mouth is totally Iraq right now. No, I wasn't sure if when you're seeing that, you're not diagnosing them overall, you're treating them.
Yeah.
But you're trying to save the tooth to begin with, right?
You want to, especially baby teeth, because they are they hold the place for the adult tooth. So I always kind of compare it to Pac-Man. So the little roots, the little Pac-Man, the adult tooth is like Pac-Man and it eats the baby root and to find its way up to the top. Isn't that a good analogy?
That is a really good analogy. I think you mean more like Dig Dug.
I don't know. I wasn't born here.
That is true. Yeah, but you were born, at least you knew Pac-Man. I give you that.
Okay. Yeah.
But that is a great analogy that it is making its way
the
up.
Root. Yeah. It chases the root to come up.
That's pretty brilliant. I think everybody will get that reference. So when you are treating these kids, you kind of are seeing both worlds, right? You're seeing the people that don't have health insurance that need this care, but in Dublin, you've got a whole nother set of people, right?
Yeah. Yeah. The people that want more aesthetics.
But it doesn't matter. Well, the aesthetic thing I think is I don't know how new it is to dentistry, but I'm seeing a lot more people pushing that.
With kids, you mean, or just
no? I mean like adults.
Adults wanting it.
Yeah, I see so many people that are pushing for the aesthetically pleasing part.
Yeah, it's kind of funny. Sometimes I'll have patients come in and they have a lot of cavities, but they just want to whiten their teeth. And I was like,
right? They want it to look good. It's not functional, but it looks good in a picture.
Well, I'm like, it's gonna hurt, if you have this cavity, and we're gonna put, we need to focus on other things. Granted, I'll eventually whiten their teeth, but I do want them to focus on taking care of the health of their teeth first before we work on the aesthetics.
That's going to be a hard conversation to have where it's like, I know what you want, but we've got to treat this because, again, you got to save that tooth.
Yeah, you just educate. You just give them as much information as you can.
Is the patient always right? Can they say, I'm not doing that. This is what I'm going to pay for?
Yeah, I'll do as much as I can, but sometimes it goes beyond the standard of care. And if it's something that is not the standard of care, then I won't do it. I will just say this is not something I can do. It won't benefit you and it will make it worse.
Right. But have that credit card handy just in case.
Yeah, of course. I'll have Ellen standing right there.
I think Ellen's already ringing that thing up. No, they're good.
She's like, I've got them on auto pay. It's okay.
But when you are you one of the offices that also offer, I've seen a lot of them are getting into Botox and those kind of injection things.
Yeah.
Did you guys do that as well?
Yes.
And are you seeing a lot of people that are coming in, I only know, I used to have a client that was a plastic surgery center,
Okay.
and I would see the before and after. You know, it kind of looked like these people would come in, it looked like they were in severe
Look
pain.
like cats, right?
Yeah, well, it's like the Easter Island thing. You know, they couldn't move their face, but it was like they were so happy because they had no wrinkles. Is that the new trend? Is that dentists are getting into that because they have steady hands and they know how to inject?
Well, we do give a lot of injections. Remember, we're one of the few really doctors that give injections consistently. You know, medical doctors don't give injections unless they're plastic surgeons or whatever.
They give you notes. Here, get these pills.
But mostly nurses do it for them. But I inject quite a bit in the mouth, so it was a no-brainer. Plus, some people don't want people to know that they're getting Botox. So it's an easy way to kind of hide that they're getting it done. I like a more relaxed look. I don't like the frozen look. So you just come out looking a little bit more refreshed.
I like the permanently scared look, where their eyes are wide open.
Do that, or angry, like permanently angry.
Yeah, like they're confused. They're thinking really hard, and they're like, "Do I like my molars? Yes, I do."
Botox is a thing, though.
I did read that. I almost brought that in today because I was like, "Why would a man want to get his face shot up?" Have you done that?
To myself?
Not to yourself. Obviously, people will see on Facebook that you're not
I'm
all
very
Botox
wrinkly.
That's not what I mean. I mean, you're getting up there in age, sure. You're on the
I'm
40 under 40. You're on the 40 under 40. When is that again? When do you leave for that?
End of May.
Okay. We got a few shows to pump that up before, and then that issue will come out. And everybody go get Incisal magazine.
Incisal Edge.
It does not matter. Can someone buy that at a store?
What if there's an Incisal magazine that got the wrong magazine?
You could
then
be in that one too.
In it.
You're not really thinking ahead. We just plugged them, so now they're going to know. I got to get this woman that has a radio show that's under 40 years old could be on the show.
Okay.
And she's Brotox.
It's Incisal Edge, and I do Brotox.
Okay, but
and
my
Botox.
question is, have you done Brotox yet?
No. Guys are a little timid, but they will come once their girlfriends come. And wives.
Really?
I guarantee it.
So it kind of works the same way as dentistry.
Yeah.
If you can get the female to come, the male will come along.
I'll just make an appointment for you. You can show up.
Yeah, I just want it in one eyebrow. I just want one eyebrow constantly raised.
Just raised? Okay.
Yeah, so it looks like I'm really...
And the other one, I'll depress it.
Yeah, like I'm thinking hard about what you're saying, but I'm really not listening.
Okay, well, that's like every day.
What'd you say? Oh. Well, I think, in the remaining parts of this show that we have left, which is not much, I just want to get your overall feel about, when you're treating people and you see the decay. Like I learned something brand new today. I didn't know you could get cavities in between your teeth. But when you're seeing these patients that are coming in based on, because you said you're getting a lot of calls these days, right?
Yes, we are.
So there's nothing to fear if you do have cavities, if you do have these issues. You're not going to judge anybody.
No, of course not.
But you will give them a little like, hey, you might want to cut back on this.
Yeah.
So you're not going to take it away.
No, you don't have to completely take it away. You just have to cut down.
I feel like you're very open to letting people live their life.
You have to. Life is short. You can't. I mean, I eat candy. I mean,
You should. You're a dentist that just admitted to eating
I
candy.
eat candy and chocolates.
They're going to revoke both your medical
apple juice
licenses.
Occasionally.
Oh my! That's got to be the worst.
I
That's got to
haven't
be worse than
drank-
Mountain Dew.
I don't know.
That's
Let's
like pure
do
sugar.
a science. We can do.
We should do that.
We'll do
You should do that on
yeah.
Instagram with your
Let's
hygienist.
I'll put it on each of your teeth. A little drop of Mountain Dew and a little drop of apple
I'm
juice,
not
and
the
see
guinea
which
pig.
one decays
I think we
faster.
get your hygienist
Like we just-
together and do a little Instagram video so people can see. That'd be interesting to know how much sugar is in apple juice, which we're giving our kids, versus Mountain
Well,
Dew.
they do say to water it down.
Who said? Who says
People.
that?
They.
Oh, just people.
Just they. People.
Just people.
People.
Okay, good. I feel we've ended this show on a high
Professional
note.
people.
We started off so good, and then this is how we're going to end the show for the week. That's
There's
all.
always there's something each week though.
Yeah, it's a highlight. That's all we have time for. Why don't you send us home for the week?
Thank you for listening to the River Park Dental Show. You can see us or contact us at 614-689-8686 or visit our website at riverparkdental.com.
You've been listening to a Morris Media production.